catering to the needs of individuals living in long-term care. That's the focus of a new pilot program being rolled out by the city, but one that some say is in stark contrast to what the province plans by rolling out more of the same.
I think, if nothing else, the experience of the pandemic, and let's be candid, the tragedy of the pandemic in long-term care, has caused this kind of a fundamental rethink.
The rethink is actually something that many in long-term care have been thinking about for a long time. Now the city is getting around to it with a pilot called CareTO, investing more than $4 million this year to offer more personalized care for residents in at least one city-run home, hiring more staff, providing more comfortable spaces, and flexible schedules among the changes.
I believe that the care, compassion, accountability, respect, and excellence values are the cornerstone to my work, and apply them to the way I treat residents and work with my fellow staff members.
The newly re-elected Ford government has promised 30,000 new long-term care beds by 2028, with funding to replace old beds and build new facilities. Those on the front lines of long-term care say it's the quality of care that counts.
I'm very worried that it's not enough, and I'm worried that the provincial government's strategy to expand long-term care relies on kind of doing more of the same and expecting different results, which is absolutely not going to be the case.
The province also plans to hire more inspectors to ensure current care standards are maintained, but advocates say there's no evidence of that yet. Education and training current and new personal support workers is part of the city's CareTO pilot, with plans to expand based on feedback from an independent University of Toronto study.
I won't speak for what the province has done, but I will say, even in our own case, it's millions of dollars that we have allocated in addition to what was being allocated before.
Throughout the COVID pandemic, long-term care homes were the focus of major outbreaks and a large number of deaths as a result of the virus. Now the focus is on what more will be done by both the public and private sectors to make things better for all.
They're human beings who need not just life, but quality of life is actually the number one priority.
Mark McAllister, City News.